Did you know that a woman giving birth can face a very different level of risk depending on which South Asian country she lives in? Today we are ranking 8 South Asian countries by maternal mortality rate from the highest to the lowest. But first, what exactly does maternal mortality rate mean? The maternal mortality ratio, or MMR, tells us how many women die from causes related to pregnancy or childbirth for every 100,000 live births. For example, if a country has an MMR of 100, that means there are about 100 maternal deaths for every 100,000 live births. This number includes deaths during pregnancy, childbirth, and within 42 days after the pregnancy ends, when the death is related to the pregnancy or its management. And this is important because most maternal deaths are preventable. The World Health Organization says the main causes include heavy bleeding, infections, high blood pressure during pregnancy, complications during delivery, and unsafe abortion. Having skilled health workers available can make a huge difference. For this ranking, we are using the latest internationally comparable 2023 estimates from WHO, UNICEF, UNFPA, the World Bank Group, and UNDESA. So let's start from the country with the highest maternal mortality and work our way down to the best performer. Number 8 is Afghanistan. Afghanistan has the highest maternal mortality ratio on our list. Its estimated MMR is 521 deaths per 100,000 live births. That is an extremely high number. To understand why the number is so high, we have to look beyond hospitals. Afghanistan has faced years of conflict, economic problems, natural disasters, and a fragile health system. WHO reports that around 1/3 of the population lives in underserved areas, while shortages of qualified health workers and limited access to essential services make healthcare especially difficult in remote places. In 2025, closures of health facilities also disrupted services such as facility-based deliveries and family planning. And pregnancy does not wait for a hospital to become available. A mother can develop serious bleeding, high blood pressure, or another emergency very quickly. If she cannot reach a trained health worker in time, a problem that could have been treated can become deadly. So Afghanistan's high number is not simply about mothers. It shows how conflict, poverty, distance, shortages of health workers, and a weak health system can all come together. WHO's recent research also shows that maternal mortality is much higher in fragile and conflict-affected settings around the world. Number 7 is Pakistan. Pakistan has an estimated maternal mortality ratio of 155 deaths per 100,000 live births. This is much lower than Afghanistan, but it is still a serious challenge. One important problem is access to healthcare, especially in rural areas. WHO has reported that women in rural areas can face long journeys to reach health facilities, transportation problems, financial barriers, and limited decision-making power. And when an emergency happens during childbirth, waiting too long can be dangerous. Pakistan has also been working to improve this. For example, in Punjab, health authorities have expanded basic health units and emergency obstetric services. Ambulance services have also been introduced to help pregnant women in rural areas reach birth centers faster. So Pakistan is not standing still. The country has made progress, but the big challenge is making sure that progress reaches every mother, especially women living far from major hospitals. Number 6 is Nepal. Now we move to Nepal. Nepal's latest internationally comparable estimate is about 142 deaths per 100,000 live births. And Nepal has actually made huge progress. According to WHO Nepal, the country's maternal mortality ratio has fallen by about 71% since 2000. That is a massive improvement. But Nepal still faces a difficult problem: geography. The country has mountains, remote villages, and communities that can be very far from advanced medical care. When childbirth becomes dangerous, reaching a hospital quickly can be difficult. At the same time, Nepal has greatly increased access to skilled birth attendants. WHO data shows around 80% of births are now attended by skilled health personnel, compared with much lower levels in the past. So Nepal deserves credit here. Number 5 is Bangladesh. Next is Bangladesh, with an estimated maternal mortality ratio of 115 deaths per 100,000 live births. Bangladesh is another country that has made impressive progress. In fact, WHO says Bangladesh reduced its maternal mortality ratio from 376 in 2003 to 136 in 2023 in one national progress account, while the latest internationally comparable 2023 estimate is about 115. So what helped? Bangladesh has expanded access to maternal health care and skilled health workers. WHO reports that about 70% of births are now attended by skilled health personnel, a huge improvement from the past. But there are still challenges. Some women live in poor or remote communities where reaching quality care can be harder, and when there is heavy bleeding, infection, or dangerous high blood pressure, pressure, a delay can quickly become an emergency. So Bangladesh is a great example of a country that has made strong progress, but still has more work to do. Before I tell you which country comes next, like this video and subscribe if you find this information helpful. And the number one country might surprise you. Number 4 is India. So India's estimated maternal mortality ratio is about 80 deaths per 100,000 live births. India has made a major improvement over the years. One important reason is the growing number of women giving birth with skilled health professionals. WHO data shows that about 89% of births are attended by skilled health personnel, a major increase compared with 2000. But India is enormous. This is one of the biggest challenges. Healthcare can look very different from one state to another. Some parts of the country have excellent hospitals and very high-skilled birth attendants, while other areas still have fewer healthcare resources. Indian government data shows this difference clearly. Some states and territories have almost universal skilled birth attendants, while some northeastern states have much lower levels. So India's progress is impressive, but the next step is making sure every woman, no matter where she lives, can receive the same quality of maternal care. Number 3 is Bhutan. Now we reach the top 3. At number 3 is Bhutan, with an estimated maternal mortality ratio of 47 deaths per 100,000 live births. This is a huge difference compared with the countries at the bottom of our ranking. Bhutan has invested heavily in maternal health care and has built a strong system for reaching mothers. WHO has highlighted Bhutan's high levels of institutional delivery and skilled birth attendants, along with free access to a strong health system and emergency obstetric care. Bhutan has also seen a dramatic long-term fall in maternal mortality. A national health survey notes that the country's MMR fell from hundreds of deaths per 100,000 live births decades ago to a 2-digit level today. That deserves real praise. Number 2 is Maldives. The Maldives has an estimated maternal mortality ratio of just 32 deaths per 100,000 live births. That is one of the lowest levels in South Asia, and there is an interesting reason behind this success. The Maldives has built a strong universal health coverage system. WHO reports that 100% of births are attended by skilled health personnel, and more than 95% of pregnant women receive antenatal care. The country also provides free antenatal care and other important health services through its universal health coverage system. But the Maldives has a unique challenge. It is made up of many islands. Healthcare access can be difficult when people are spread across a huge area of ocean. Even with this challenge, the country has built systems that help mothers receive professional care, and its recent maternal and child health achievements are something the country can be proud of. Number 1 is Sri Lanka, and finally we reach number 1. The South Asian country with the lowest maternal mortality ratio on this list is Sri Lanka. Sri Lanka's estimated maternal mortality ratio is about 18 deaths per 100,000 live births. That is the best result among the 8 countries in this ranking. So why does Sri Lanka perform so well? One major reason is its long investment in free and widely available healthcare. Sri Lanka has built a strong public health system with maternal services available without direct payment at the point of care. The country also developed a strong professional midwifery system and has used data to improve maternal health care. WHO Sri Lanka describes the country's success as being connected to free and equitable maternal health services, professional midwifery, data-driven decisions, and continuous improvements in quality of care. And WHO data reports 100% of births attended by skilled health personnel in Sri Lanka. This does not mean Sri Lanka has solved every maternal health problem. Even a low MMR means women still die from preventable complications. But compared with the other countries in this ranking, Sri Lanka has built a system that gives mothers a much better chance of receiving help when they need it, and that is something worth recognizing. The difference between 521 and 18 is enormous. But this ranking is not about saying one country is good and another country is bad. Maternal mortality is influenced by healthcare access, poverty, geography, education, trained health workers, emergency services, nutrition, transportation, and many other factors. And the good news is that countries can improve. Nepal, Bangladesh, India, Bhutan, Maldives, Pakistan, and Sri Lanka have all shown that progress is possible in different ways. The real goal should be simple. No woman should die just because she could not get the right care in time. The WHO estimates that more than 700 women died every day from preventable causes related to pregnancy and childbirth in 2023. That means this is not just a number on a chart. Behind every number is a real mother, a real family, and a real life. If you found this ranking helpful, like the video, subscribe to the channel, and comment below which South Asian country you're from. And remember, these numbers are estimates, so they can change as new data becomes available. Thanks for watching.